Welcome to the NSJD show, Pakistan's first fitness and self-improvement podcast, in which we discuss tools for self-improvement and physical and mental well-being. I'm Noroze, Sikander, Junaid, Dani, and I've been into fitness for 14 years. Today's guest is Dr. Omair Durrani, who's again a good friend of mine from school, and he is a dentist and general practitioner who has done a few certifications. Number one in restorative dentistry, and the second one is in endodontics. So what did we talk about in today's podcast? We started our discussion with oral health, obviously, because he's a dentist. But why I wanted to have him on the show was to discuss oral health in the sense that it's something that's very, very overlooked. जिस तरह कि मैं कुछ psychologists और life coaches को लाया हुआ हूँ podcast में, because those things about our well-being and our health are often overlooked in our everyday life. इसी तरह oral health and the things that go on inside our mouth और जो वहाँ मसले मसाइल होते हैं, they are very, very overlooked. So we started off with kind of like a definition or a description of what exactly is oral health, and then we dove deeper into this topic कि अच्छा जी oral health अपनी अच्छी रखने के लिए क्या आदत इंसान में होनी चाहिए, क्या चीज़ें proactively हमें करनी होती हैं to make sure कि हमारी oral health अच्छी है, और अगर ये चीज़ अच्छी ना हो तो क्या मसाइल आते हैं हमारे बॉडी में. बिकॉज वी यूजुअली थिंक कि अच्छा यार अगर दांत में मसला है तो दांत में ही मसला है ना, यहीं इधर कहीं मसला होगा, इधर ही रहेगा मसला. बट अपेरेंटली एज पर आवर कॉन्वर्सेशन एंड एज पर द लेटेस्ट रिसर्च, एज पर द लेटेस्ट होलिस्टिक स्टडीज़ ऑफ द ह्यूमन बॉडी दैट हैव बीन डन, आई फाउंड आउट एंड यू विल फाइंड आउट एज वेल कि ओरल हेल्थ ना अच्छी होने की वजह से बाकी जिस्म पे भी फ़र्क पड़ता है. अब वो क्या फ़र्क पड़ता है, दैट विल गेट टू हियर अबाउट ऑल इन द पॉडकास्ट. वी ऑल्सो डिस्कस्ड अबाउट द टॉपिक ऑफ फ्लोराइड इन टूथपेस्ट्स, क्योंकि आजकल एक स्टिग्मा थोड़ा फैला हुआ है कि यार टूथपेस्ट में फ्लोराइड नहीं होनी चाहिए और से मसले मसाइल होते हैं. तो क्या ये चीज़ सच है कि नहीं है, what is his exactly point of view. And we also talked about good habits in terms of or the right way exactly to make sure that we have good oral health. क्या ठीक तरीका है ब्रश करने का, क्या ठीक तरीका है फ्लॉस करने का. So if you like the video, please make sure to click on the like button. उससे होता क्या है कि YouTube का algorithm ऐसे setup हुआ है कि if you click on the like button, it really helps us get across to the right audiences in terms of our total outreach. And if you like the content in general and you want to see more physical fitness as well as mental fitness and well-being content going forward, please subscribe to the channel. और हमारे international listeners जो हैं वो इस podcast को सुन और देख सकते हैं on Spotify as well. And with that, let's move on to our conversation with Dr. Omair Durrani. Buddy, thanks so much for coming in.
No problem.
I really wanted to cover this aspect of fitness. कि there's a dental क्या बोलेंगे, dental health, oral health aspect of fitness as well, that you know that even I'm not too concerned about, to be honest, on most days. So why don't we start with what is exactly oral health? उसमें क्या क्या आता है?
Oral health basically तो यही आ गया कि how your teeth are functioning, how do you feel about your teeth, is there pain, is there no pain. That's basically oral health, that everything's in a good balance. That's oral health, and
that's pretty much it. Achha.
That's very much it.
So what about other things in your mouth, the gums, the tongue, ये सब भी आता है उसमें?
Yes, so it's basically everything functions as a whole unit. ठीक है? So you can't be, if your gums are causing a problem, that will affect your teeth, that will affect your cheek tissue, that will affect your tongue. So it's nothing is isolated there. So basically, even if you take one tooth out, it basically affects your whole mouth. One tooth is caries, it affects your whole mouth. So it's everything.
Caries meaning?
कीड़ा लगा हुआ है. Decayed. Basically, yes. Yes. So everything's included: gums, teeth, tongue, throat tak bhi.
अच्छा, throat tak bhi?
Yes. So again, वो specializations तक चली जाती है बात. But yes, when you do inspect them out, you do look at the tonsils as well. वहाँ पे तो कोई इन्फेक्शन नहीं हुई भी, सारा कुछ नहीं है.
Right.
Bad breath, ये वो सारा, that's a part of it. Everything's a part of it. Yes.
ठीक है. अच्छा, इसमें it's interesting that, once when you're a child, so you have different teeth, and then obviously they fall out, then you get new teeth. So that's a different process as compared to other parts of our body. It's not like, बचपन में different बाजू था, बड़े होके बड़ा different बाजू आ गया. तो what is the age, or when should you actually start looking after your teeth? Should it be जो दूध के दांत होते हैं तब से उनका ख्याल रखना होता है?
So when you get your first tooth, ठीक है, 6 months old, like obviously.
Okay, that
obviously
first
at that point you're not looking after your teeth, but your parents should be. ठीक है?
Okay.
And as you grow older, again, you get your mid teeth, you need to take care of them. ठीक है? Because 12 साल की उम्र तक, those are your teeth. And then the transition happens, 6 साल की उम्र में, you start getting your permanent teeth. ठीक है? But again, there's a big thing in Pakistan, faced with a lot of parents as well, के बच्चों के ये तो दांत गिर जाने हैं. You don't need to.
Exactly.
Whenever you have tooth problems, tooth decay, whatever you would caries हो गया, that affects you in the long run as well. ठीक है? If a tooth falls out before it's supposed to, it leaves an empty space. वहाँ पे जो permanent दांत आने हैं, the teeth that are in your mouth, they will start drifting into close the space. That's how nature works. जहाँ भी खुली जगह मिलेगी, the teeth will start drifting in. जब permanent teeth आएंगे, they would not have space, and then you will have you
need braces or
need
stuff.
braces, yeah. And that's what a lot of people have.
Okay.
Yeah.
Achha, I didn't know if there's no force, फिर भी they will try to take up that
so
space.
Basically, just imagine like this is the middle of your mouth. Okay? All the teeth constantly want to move towards the front.
Okay.
But the teeth at the front, they stop the teeth at the back. So beach mein agar if there's a gap there, the tooth at the back will start moving towards the front.
Oh, interesting.
Yes. But at the same time, like even if you have, we'll discuss that in detail later as well. Like, even if you have a child which has caries, dental infection hui bhi hai, that infection does affect your the rest of your body as well. It's just that you don't notice it. ठीक है? Just you just said that you don't lose an arm, you don't get a new arm. ठीक है? So a good way of looking at it is that your tooth or your teeth are the only things that don't regenerate properly. मतलब your arm, like you have a scratch on your arm, you have a cut on your arm, it repairs itself. Your teeth don't.
Right.
So it's a good thing that you have two sets of teeth. एक trial हो गया. But again, once your teeth are damaged, they're not going to come back. But at the same time, when you have an infection in your mouth, बच्चों का दांत था, infection हो गई, गिर गया, that's gone. But that infection does travel to other parts of your body. And the damage it's having on your child's heart or their lungs or Sara, you don't see those because your other body organs are regenerating at that time. But again, they are causing damage. And over a period of 10, 15 years, it does add up. And so that does not mean that just because bachcho ke daant hain, to you don't have to take care of them. Yeah, you let that infection stay there. So,
right. So that can basically affect other organs, other things, and you don't even know about it.
Yes. So and
that's just building up.
Yeah. So again, ये बच्चों से फिर हटके हो जाता है. But for example, when you have dental gum issues, for example, you have it's always caused by bacteria and microorganisms, basically. They travel to other parts of your body, ठीक है? Dementia में. So dementia patients, when you get autopsies done and stuff after they pass away, you have oral bacteria in the brain. Okay. So again, they travel through your bloodstream. Okay? So basically, when you have a dental infection, whether it be gums or your tooth, it does have access to your bloodstream. It does transfer somewhere. Okay? It does. जब आपके body के अंदर कहीं pimple where, for example, जिस तरह एक pimple बनता है, you can see it coming out from the skin. When you have a dental infection, that happens as well. So you can either see it कि it can कभी बार मुंह में पिंपल्स बन जाते हैं and it's draining out, ठीक है. कभी कभार दांत इतना ज़्यादा degenerate कर चुका होता है, इतना खाया क्या होता है कि वो दांत के थ्रू बस निकल आती है. But sometimes it just goes into your bloodstream and
you have no idea.
You have no idea.
But you specifically mentioned dementia patients have this issue. Why them?
So again, there's it does not it's not been जो मैंने at least पढ़ा है कि it's not a causing factor from what they've known, ठीक है. But again, it is there and it does contribute to the degeneration of the nerves in the brain.
Okay.
So yes, and it's not just the brain, it's the heart as well. Like majority of the heart patients you see, unki bhi autopsies mein, they do have oral bacteria in the heart. There's a strong correlation between heart disease, heart attacks, strokes even, okay? And oral health.
So basically the oral health is ultimately, or it could be, causing problems in the heart and the brain?
Yes. Brain ka, again, there's the causation wala part is still, at least I haven't read it, but it's
correlation hai.
Correlation hai, causation pe wo nahi hai, but at least it does contribute to it. And either way, like whether or not it's causing it or not, you don't want that your mouth bacteria in your brain at the end of the day. But yes, heart mein, yes, there is a big causative factor.
Right. So I came across this study about the bacteria in our mouth, and there's apparently, and you would know more about it, there's a bacteria that's not there initially, and it develops through, pani ka glass share karna and stuff like that, called
so that is basically Streptococcus
or short form Strep mutant.
Baby. So that's basically the main bacteria that causes cavities, okay?
Right.
It is infectious. That's what not a lot of people know. Okay, it is infectious. Saliva से दूसरों को भी लग सकता है. So basically, whenever you say कि candies नहीं खानी चाहिए, सब कुछ नहीं करना चाहिए, जब आपके मुंह में वो गई है, for example, there's sugar in your mouth, it does not magically start decaying, it does not magically start causing cavities. It's basically a bacteria that starts feeding on the organic matter on top of your tooth, which is whatever food debris and everything that's left there, and that causes tooth decay.
That basically produces an acid, right?
That produces an acid.
That causes it, yeah. So this... is it a bacteria then? A Strep mutant is like a bacteria? Okay.
It is bacteria.
So is it like, does everyone have it or nahi?
Some people have more of it, some people have less. Basically, when we tell you to brush your teeth, when we tell you to clean your mouth, it's basically eliminating that bacteria in your mouth as much as possible.
Right.
And genetics maybe, but it's vertically transmitted as well, meaning if a mother has a lot of it in her mouth, the child will have it.
Oh, okay. By birth, the child might have it.
Yes.
Okay. Because the study that I read was that by birth, nahi hota, it's only transmissible.
No, so again, naturally, like if the mother does not have it, you shouldn't. But there is evidence of vertical transmission, jisko kehte hain ke, from the mother to the child.
Right.
Of ye strep mutants.
ठीक है. So ultimately, it's the acidity or the acid that builds up that's destroying your teeth and
so
cavities.
Basically, what I try to tell a lot of patients as well, and a lot of them don't really believe me as well. It's हमारे हमेशा ही होता है कि sugar नहीं खाना, सारा, that's basically what, and that is true. But it's not the amount of sugar that you have. It's the frequency with which you have it. Okay? So one example would be like if you're having coffee. Okay? No, first I'll explain what happens when you have sugar.
Okay.
When you have sugar, whenever you have something to eat, your mouth becomes acidic. जब acidic होगा उतना तेज bacteria काम करेगा. It's basically a good environment for the bacteria to thrive in. Whenever you have something to eat, the pH level of your mouth goes down, acidic हो जाता है. Your saliva is a buffer. It brings the pH level back up. So, for example, you eat something, the mouth becomes acidic. After about 5 minutes, 10 minutes, it goes back up. Okay? So, for example, if you have a cup of coffee, you have it, you finish it in 5 minutes, aapka acidic hua muh, and then it goes back up, you're fine. But some people have it for an hour. ठीक है, एक sip लिया, छोड़ दिया, 15 मिनट बाद दूसरा sip लिया, then your mouth's continuously acidic. ठीक है. For example, you have Snickers bar. You एक ही go में तुमने एक Snickers bar खा ली, you have 5 Snickers bars in like 5 minutes. ठीक है. That will not cause as much damage than के you have one Snicker bar, you're eating it for an hour. ठीक है. You're taking one bite after every 5 minutes, 6 minutes. And constantly your mouth is acidic.
Right.
It causes a lot of damage.
Right. I hope the people listening, they don't take this as an excuse.
Excuse me.
5 इकट्ठी खा लेता हूँ मैं.
I'm not
advocating
for that, but basically ये भी नहीं समझना चाहिए कि मैंने तो सिर्फ एक कैंडी खाई है तो मतलब एक बार खाई है
तो क्या हो जाएगा?
No, you cannot have it for an extended period of time. Basically. Right. So what जिन लोगों में बहुत ज़्यादा cavities का issue होता है, सब कुछ होता है, we do tell them के limit your meal times. So you have a lunch time, 2 बजे आपने खाना खाया, 2 बजे से 2:30, 2:20, however much long it takes you to eat. After that, just stop eating. Like don't snack after every 15 minutes. That will cause a lot of problems.
Right. But by snacking, you basically mean the sugary foods, right? Yeah, anything.
Basically, everything does have sugar in it. Like literally, if you have a sausage, go and look at the wrapper. Sausage it has sugar in it for some reason.
Right.
Bread, that is carbohydrates. That's sugar basically.
But is there like an amount that we should be? इस amount से कम खाएं हम to be on the safe side?
Again, the amount does not contribute that much. The frequency does.
It's the frequency. Okay.
The frequency does. So it's basically कभी आपने वो देखा है वो जो एक एक्सपेरिमेंट भी करते हैं वो कोक के ग्लास के अंदर दांत छोड़ देते हैं and they're like देखो दांत को क्या हो गया वो कोक का इतना बड़ा ग्लास उसके अंदर आप you just dip it for 2 minutes take it out the tooth's perfectly fine nothing happens but you leave it overnight it gets messed up ठीक है. So basically that's it. चाहे अब वो कोक 5 गैलन के उसमें you put the tooth in, वो एक दफ़ा wash over होके चला गया in your stomach, the tooth does not care, ठीक है. But if it's continuously being bombarded by that coke or whatever it is, that will cause problems.
Right. Okay. Coming back to what we were originally discussing, I've never really thought about this, but जो हमारे दूध के दांत आते हैं and then they fall off and then the proper ones come, or maybe I read it when we were little. Why does that happen? Why don't we get just like one set of teeth?
That's a good question. I mean, I haven't thought. I'm pretty sure I have, but I don't know.
Okay, you remember? Maybe you read about it बचपन में,
but again, like I've just accepted it कि बस 2 आते हैं.
Yeah.
ठीक है. I always look at it as कि you have a trial version of your teeth.
That's
you mess up as much as you want.
Yeah,
ठीक है.
yeah.
You shouldn't, but again, you have a second go.
Yeah, I think that could be a possible cause, right? In case they fall over and stuff.
But again, there are physiological reasons as well. Like the size of the teeth that you have when you're a child is different. The mouth, your jaw does grow as you age. ठीक है? The size, मतलब अगर तुम्हें बचपन में ही permanent दांत आ गए होते, ठीक है? They would be too large for your mouth to fit in. ठीक है?
Right.
So जब बचपन में आपके दांत आते हैं, you have 5 teeth per side. They're small, your jaw is small, it fits in. It's good. But as you grow older, those teeth are too small for your large jaw. New teeth come in, more teeth come in. ठीक है? Your permanent dentition has 8 teeth per quadrant. ठीक है? So
okay, yeah.
8 teeth
8 into 4 ठीक है.
ठीक है? And जो 8वां दांत है वो आपका wisdom tooth आ जाता है. ठीक है? So again, the permanent teeth are a lot larger. They're a lot more sturdier in a way, and they help you eat a lot better than your primary dentition would. And I cannot imagine a baby having a adult molar. ठीक है?
Yeah.
Basically, your half the mouth would be one tooth. So that's probably it.
Yeah, and it also could be that babies bite you a lot, and if they have adult teeth, do dard ho gaya. I'm just kidding.
you know that is a problem. So some it's called neonatal teeth. So some kids are born with teeth. ठीक है?
Oh.
छोटे छोटे दांत होते हैं, and that is a problem for mothers who are feeding.
Right. Okay.
That is a big problem क्योंकि they bite, they can't control it, they bite themselves. So that does happen.
And they fall off at the same age, 6-ish.
Yeah, yes. So उसमें लेकिन वो होता है कि some of them are extra. So basically it's not always, those are called supernumerary teeth. So they're not, you don't always have a set amount of teeth. Like there's a normal amount, some people do have extra teeth. I've seen मतलब कि 4-5 extra दांत लोगों के अंदर. So that does happen as well.
Right. ठीक है. So in oral health, since there's teeth mostly, and then we have our tongue. And you know, आजकल वो थोड़ा Instagram पे कभी-कभी ads मेरे सामने आ रहे होते हैं of tongue cleaners and stuff like that.
I hate those.
Is that something that we need?
So tongue cleaners, yes, like it is good to clean your tongue as well. Again, but most of the brushes do the same thing. It's basically के the problem isn't कि your brush, like brush के पिछली side पे you have those bristles as well. You can clean your tongue with it. The problem isn't कि you don't have specialized equipment for it. The problem is most people don't do it. You can just take your brush and clean your tongue as well.
I've never done that. Should I do that?
You should do that. At the back of your tongue, there's a lot of bacteria that can be there.
Right.
So you should clean your tongue.
But just take the toothbrush, turn it around and उसे करना है.
Even if you don't have it, some toothbrushes have it. Even just use the normal brush. Just clean your.
Okay. But that's something that's a good practice for oral health.
That's good. Yeah. It's a must, I would say.
Right.
Yeah.
Okay.
So flossing again. People don't do it, but you need to.
So you need to do both brushing and flossing.
I would say flossing is more important than brushing.
Okay.
It's a lot harder to do. You can brush easily. You can brush within. You should brush for about at least 4 or 5 minutes. But log jaldi se kar lete hain. But flossing takes time. You have to clean individual teeth.
Right.
But think of it this way: whenever you're brushing, you are cleaning the surfaces of your teeth. Okay? The majority of the bacteria, या जब भी आपको कीड़ा भी जो लगता है, it's in between your teeth. It's underneath your gums. ठीक है? You're not getting those. They are always there. ठीक है? You would have seen. Do you have bleeding gums?
No.
But you've
very
heard,
very rare. Yeah.
But you've heard of people having bleeding gums. ठीक है?
Yeah.
वो यही बोल रहे होंगे कि I'm brushing my teeth. मैं ख्याल रख रहा हूँ मेरे कहीं कीड़ा नहीं लगा हुआ, but मेरे gums inflamed हैं, खून आता है. It's basically. It's under your gums and in between your teeth. There's still bacteria there, and that's causing inflammation and stuff. When you floss, you take those out. ठीक है? When you floss, you're cleaning. बाकी जो brush से काम हो रहा है वो तो हो ही रहा है. ठीक है? But you're doing extra cleaning as well, and वहीं पे सबसे ज़्यादा आपके bacteria आपको मिलेगा भी. Gram-negative bacteria होते हैं. They cause bad breath. They cause gum issues. So yes, flossing is and. What I see a lot and a lot of people tell me कि जी हमने फ्लॉस करते थे but हमने छोड़ दिया क्योंकि bleeding होती थी वहाँ से, तो हमने फ्लॉस करना छोड़ दिया. Whenever you see कि bleeding हो रही है किसी जगह से, that needs more flossing rather than stopping. So whenever there's bacteria there, whenever there's food stuck there, ठीक है, वहाँ पे inflammation होना start हो जाती है. Like आपको कहीं भी चोट लगेगी, inflammation हो जाती है. It just show, और वहाँ पे जब inflammation होगी, there's more blood coming in, वहाँ से bleeding भी start हो जाएगी, the area becomes sensitive. But that just shows that there's something wrong there, there's something stuck there that you need to get out, you need to fix, and that should encourage you to floss rather than stop.
Right.
Yes.
And does it ever happen that flossing too aggressively, that might be the cause of the bleeding?
Very rare. Like it's again, if like for example, if you're my patient, if you're coming to me, I'll tell you how to floss. And again, I can't imagine that someone would be able to do that, but we can't underestimate people as well.
Yeah.
But again, if it's starting to hurt, like if you're बहुत ज़्यादा force आपने नहीं लगानी, it's just simple pressure. And it's not basically another thing that what people do in flossing is like they just push push down, like आपने दांतों के बीच में लिया and you push it down and then you pull. So what you have to do, the pushing down is like basically the start of the flossing. Like that does nothing.
Yeah.
When you've pushed it down, you pull it tight against the tooth and just scrape it up.
Exactly.
So दिमाग में आपने ये सोचना कि you're scraping the surfaces of your teeth.
Yeah.
And that, so basically that should not hurt. Like no matter what you're doing, the force that you're applying should be upwards, not downwards.
Exactly. Yeah. Yes. Downwards तो आप उसको बस पकड़ रहे हैं, that particle.
आप उसको बस वो अपनी starting position पे लेके जा रहे हैं.
Yeah.
ठीक है. So you should not be applying too much force going down. If you're applying too much force going down, you're just forcing whatever it is in your teeth deeper into your gums.
Yeah. Interesting. The last time I went to the dentist, he said, I told him कि मुझे random pain, कभी यहाँ हल्की सी दर्द, then it goes away, यहाँ हल्की सी दर्द. He took a look at my teeth and he said that you just need scaling. They're just dirty teeth. That's what he told me. So, but you have a different opinion, I think.
You might have definitely needed scaling. Well, most probably everyone does. Like after every 6 months, you should get it done. But most probably, so there are two reasons. Again, what was the type of pain that you were having? The other is you might have small cavities, which you can't see at that point in time. X-rays aap lete ho. So basically, when you have a cavity on the surfaces of your tooth, jo aapko nazar aa rahi hai visually, you can identify them. Aram se nazar aa gaya, acha ye kya. Sometimes you have it jahan pe aapke do daant mil rahe hain. Uske exact point pe aapko, so you can't visually see them. And when they're very small, X-rays don't pick them up. But again, it might just be sensitivity as well. That's normal as well. Sometimes sensitivity is idiopathic, which means that there's no reason, it just happens.
Right.
Sometimes there are many reasons for sensitivity. Gum recession ho gaya, sab kuch ho gaya. But again, if it's coming and going and it's not always there, thande pani peene pe, it might be you have a small cavity. And when cavities are very, very small, if you take care of them, fluoride ke saath, if you're brushing your teeth, the water has fluoride, your toothpaste has fluoride, they do heal sometimes. But not always. But when they're very small, I think the limit was 0.5 mm se choti ho. Again, I don't know who's measuring that, but they do sometimes heal themselves. But not always.
Right. Fluoride se mere zehn mein ek baat aayi, but we'll cover that later. So what I was saying was that, so he said that, because I could see that, there's stuck, there's things stuck here. Like white stuff. What's it called? Calculus. Like not the math calculus.
No, not the math, but it's spelled the same way.
Okay, spelled the same way. Right. So he basically said that you're not brushing efficiently.
Yes.
You need to brush better. And he said, and I said, yaar, main to karta hu.
I would say you need to floss better.
Yeah, but I don't floss.
So you would have noticed that jo jahan pe jama hua hoga, that would be basically in between your teeth. Yeah, very low.
Yeah.
Your brush isn't getting there. And if you are brushing so aggressively that tum itna niche tak ja rahe ho gum ke kareeb, you're damaging your gums. So you need to floss.
Okay. So I asked him, what's the way to brush? I think he was just busy. So he said, yaar, YouTube kar lo. So फिर मैंने घर जाके मैंने YouTube किया. And I saw that apparently I'm not brushing correctly at all. And that's where I need your thoughts.
There are so many ways to brush. When I was in dental school, like हमने भी there are about 5-6 techniques.
Okay.
I don't think they work. In the sense that they might work, but I cannot in good faith tell a patient कि यार इस तरह दांत ब्रश करो 50 मिनट लगाओ एक दांत पे नीचे से स्ट्रोक ऊपर लेके जाओ एक दांत. I tried that as a student. I couldn't.
Okay.
Again, brush as you would. You should be using a medium brush, not a hard brush. A lot of people want to literally scrape their teeth. No, that causes a lot more problems than it solves. The brushing should generally be away from your gums. The techniques which they show you are generally while you're brushing you don't hurt your gums. Usse ye nahi hoga ki you would be cleaning more efficiently. It would just be you're not hurting yourself while you are cleaning. So I do not think कि वो आपकी cleaning efficiency ज़्यादा करेंगे. And again, it takes so much time again, mental energy to do that कि no one's going to be actually following those techniques. ठीक है? So that's why I don't really advocate. If you're going to spend 5-10 minutes in the bathroom cleaning your teeth, I would rather you brush your teeth for about 2 minutes properly, सारे surfaces, ठीक है? Normally however you would, ठीक है? And floss. ठीक है?
Right.
Water pick basically is another substitute to flossing. Interdental brushes are substitute to flossing, but basically get in the middle of your teeth.
Right.
The places which are not being cleaned properly, जो वो बता रहे हैं आपको, those are most probably interdental spaces, ठीक है? Which are in the middle of your teeth, and no matter how you brush, you're not getting there. You need to floss or use interdental brushes. Again, those are alternatives, but simple brushing is not going to, it's a good starting point, but it's not going to give you perfect dental.
Acha. Because the technique that I'm doing now is like, you know, if this is the brush, वो 45 degree पे करके गम वाली जगह पे मारना, and then both, so this is the teeth, इधर भी मारना और इधर भी मारना. That's what I'm doing.
Basically, yes.
Yeah, but you're saying कि that's not.
Again, that is good. ठीक है? मतलब again, that's a very simplified form of it. कुछ होता है 45 degree पे रखो, just do upward strokes, just do circular strokes. Again, there are different ones, but again, they are good. And they will increase जो भी, if you're not doing it properly at all, yes, they will make your brushing better, but they will not solve all your problems. I'm pretty sure, like, when was this?
So this was a year back. But I've noticed since then वो calculus build up अभी नहीं आया.
पीछे की तरफ
हाँ वो नजर नहीं आ रहा. That I can't see. Yeah.
Again, it's going to help, but जो वो मसला है, flossing will solve most of your problems.
Right,
so, yes.
Right.
If a patient comes to me and they're like, they do claim that they're brushing twice a day, and I see that it's the condition is not good, then I would assume that they're not brushing properly.
Right.
And even at that time, I would not necessarily tell them a specific technique so there are names for different techniques, and I just literally just show them, again, 45 degree angle pe aapne rakhna, that's basically the correct technique, and you brush all surfaces of the teeth.
And how many surfaces are there? 3?
3.
Okay.
3. So once agar aap niche wali ki baat kare, once the tongue wali surface, once the top surface jisko aap occlusal kehte ho ya incisal kehte ho, and once the buccal, the cheek, and sabse piche wale daant ki aapki piche wali surface bhi hai.
Incisor to inko nahi kehte, like these teeth.
So yes, so basically jo aapke piche wale daant hai unki top ko occlusal kehte hain.
Okay.
जो आगे वाले दांत हैं उनकी टॉप को incisal कहते हैं.
Incisal. With an L.
Yes.
And these teeth are otherwise called incisors.
Incisors, yes.
Okay, right. Okay, interesting.
So incise means to cut, right? So incisor is cut. Incisal is the surface that cuts.
ठीक, interesting.
And that's it.
सही. So, अच्छा, अब brushing में every dentist recommends twice a day.
Yes.
Right? So what's the proper protocol? So you, before sleeping, you brush your teeth.
Yeah, you don't eat anything after.
And then you don't eat anything after. And then when you wake up, you're supposed to have breakfast and then brush your teeth, or you brush your teeth and have breakfast? वो क्या scene है?
Either just brush your teeth. You can do either. A lot of people prefer to brush before they have their food. And that's good as well. You're eating with a clean mouth, but again, that does not really matter. I would prefer if you are brushing in the morning, brush after you eat.
Yeah.
ताकि जो भी खाना है आपके मुंह में, you've eaten egg, a lot of people have sugary breakfast, ठीक है? आप cereal ले रहे हो, आप जो भी वो carbs वाला खा रहे हो, brush after you eat. But again, brushing in the morning is important, but it's not as important as brushing at night, ठीक है?
Really?
There's a phrase like a saying like brush in the morning to keep your friends, brush at night to keep your teeth. Okay? Brush in the morning because you would have bad breath.
समझ गया.
So when you have रात को सोने से so let's start with the day. when you wake up in the morning, ठीक है, your mouth is self-cleansing as well. ठीक है, you go, you eat something, you constantly you're talking after that. जो भी आपके मुंह में कुछ चीज़ फंसी हुई है, कुछ है किसी surface पे, you're moving your tongue so much, you're drinking water, you're doing various activities, that moves out. वो जहाँ पे फंसा हुआ है वहाँ से निकल आएगा. ठीक है, आपके दांत में कुछ चीज़ फंसी हुई है, throughout the day you get annoyed, you take it out. ठीक है, आप फ्लॉस करके निकाल लेते हो, सब कुछ कर लेते हो. But the problem, so that does not cause a lot of problems if you don't brush in the morning. Like it does, but not as much as अगर आप रात को ना करो. ठीक है, जिस तरह मैंने पहले बताया था, it's the frequency with which your teeth are exposed to something. So अगर सुबह आपके दांतों के बीच में कुछ फंसा हुआ रह गया, it will stay there for a maximum of 15 minutes before your tongue, मतलब naturally it will remove it. ठीक है, so it will not cause problems. But if you don't brush at night, ठीक है, you've had whatever to eat, ठीक है, आपके मुंह में फंसा रह गया, your tongue's not moving, your saliva is not being produced at वो उतना at that rate, ठीक है, your mouth becomes acidic a lot more, and it's there throughout the night, ठीक है, and throughout the night the bacteria starts feasting on the whatever's in your mouth, and that causes a lot of damage.
Yeah.
So after you brush at night, don't eat, and you need to brush at night to save your teeth.
Interesting.
You can, again, I'm saying you should brush twice a day, but brushing at night is the most important thing, and flossing at night.
When I asked my dentist how, so I should be brushing twice a day, he said minimum. Do you think that इतना ज़्यादा करना चाहिए?
Again, बात ये है कि you can brush more, ठीक है. Brushing too much would cause problems as well, ठीक है.
Like enamel wear and stuff.
Enamel wear. So again, जिस तरह मैं बता रहा हूँ कि you should use a medium brush, ठीक है. The brush does abrade your teeth a bit. People जो बहुत जोर से कर रहे होते हैं, they do have abraded teeth.
So the medium brush, basically you mean not too soft as well?
Yes. Soft is even fine.
Okay.
ठीक है. Again, but most people are comfortable with medium, but hard is bad. And the toothpaste that you use, it has abrasives in it as well at times, ठीक है, that abrade your teeth. So I would not say you should brush too often. Like, it's not going to cause too much damage, but again, जो बंदा for example 2 दफ़ा दिन में नहीं brush कर रहा, उसको आप बोलोगे कि यार आप minimum 2 दफ़ा करो, 4 दफ़ा करना शुरू, he's not going to. मतलब you should have realistic goals as well, ठीक है. अगर आप बंदे को बोलोगे यार आपने 4 दफ़ा दिन में ब्रश करना है, वो आपकी ना बिल्कुल भी नहीं मानेंगे. जब if you give him a achievable goal, they do follow it, and right. I think two times is enough. A bit more, it's not going to hurt too much, but like I don't know if it's needed or not.
Yeah.
Either.
So the people who brush at night and then they wake up and brush again, don't you think that's like wasting a brushing period? मतलब कि ब्रश करके सोए हैं और दांत साफ है, वो उठे और फिर से ब्रश कर रहे हैं.
Again, to keep your friends so that your mouth doesn't smell bad in the morning. ठीक है. So basically, when you go to sleep, your mouth dries up a bit. Everything's stagnant. ठीक है. Whenever things are stagnant, bacteria grows a bit more. Other your breath starts to smell. वो आपके जो sinuses वगैरह के through भी bad smell वगैरह आना start हो जाता है. तो again, to keep your friends, brush in the morning. You need to. I can't imagine going anywhere without brushing my teeth in the morning.
Right. Yeah, I was thinking like having breakfast and then, but that's like वो थोड़ा inconvenient हो जाता है ना. आपने खाना खाया, and then you go and brush and then you run जहाँ भी जाना है आपने. I think that's why.
Again, as long as you're brushing in the morning, it's fine. Like बहुत ही वो nitty gritty में जाना कि इससे पहले करूँ ना उसके बाद करूँ. Just brush. Okay. ठीक है. Just make it easy for yourself. ठीक है. उसके बाद you will see कि पहले करना चाहिए, पहले आप start तो करो ना. ठीक है.
I can understand where you're coming from. So it's like when someone asks me कि so मैंने exercise start करनी है, should I do this, should I do that? I'm like just start.
वही ना कि
start करें यार.
जिस तरह रिलीजन में भी होता है कि बंदा नमाज पढ़ने जा रहा है, टखने ऊपर करो, ये करो भाई, नमाज तो पढ़ना, फिर बाद में देखेंगे कि आप उसको इतने ज़्यादा चीज़ें बता देते हो, कहते हैं कि मैं करता ही नहीं हूँ भाई.
That's true. अच्छा, yeah. Okay, so you mentioned fluoride, right?
Yes.
So You know, US में there's like a very polarity among the population regarding fluoride. There's one side of the population that's very pro fluoride and one that's very against fluoride.
I've forgotten again, the reason why I've forgotten is because I believe it's non-scientific, whatever the anti-fluoride people are saying.
Right, okay.
I do not see उनका rationale था क्या है?
उनका rationale है कि भाई वो thyroid function पे होता है, बाकी organs पे कुछ मसले आते हैं.
मतलब मुझे याद है जब भी मैं जो भी मैं वो देखता था, like जिसको भी मैं देखता था बात करते हुए, everyone would have a different thing के fluoride क्या कर रहा है, उसको ultimate evil बनाया हुआ है, ठीक है. There is no scientific peer-reviewed thing that says के fluoride is bad, ठीक है. When your teeth are developing and stuff, बचपन में excess fluoride will cause a bit of problem, but that is a lot of fluoride that needs to go in. So that's why babies की toothpaste different होती है, ठीक है. Babies को आप वो कहते हो कि supervision के अंदर आप करें, ज़्यादा swallow ना करें, ये वो सारे, ठीक है. When you're an adult, as far as I know, it does not cause any problem.
Right. So basically it strengthens the bonds in your teeth, something like that.
So basically your teeth are made of crystals, hydroxyapatite crystals, ठीक है. When the fluoride bonds to it, fluorohydroxyapatite crystals बनते हैं, which are more resistant to caries, ठीक है. I hope I've gotten the name right, ठीक है.
But you have. Yeah. I read, yeah.
ठीक है. So I should get it right, but so those are more resistant to caries, ठीक है. And there is a significant difference between people you see are using fluoride, ठीक है. I'm not really sure if Pakistan के पानी में fluoride वगैरह है.
I don't think so. No.
But I think US में 1951 में introduce हुआ था basically के पानी के अंदर
tap water में basically ना.
हाँ, जो मतलब basically जो drinking water है उनका.
Yeah.
And I think there was 70-80% decrease in हाँ क्या कहते हैं caries.
अच्छा caries. Right.
जो कीड़ा लगना है जिसको आप कहते हैं.
हाँ सही.
ठीक है. तो it does work, ठीक है. And especially जब हम देखते हैं कि जो गांव से लोग आ रहे हैं सब कुछ उनके मुंह में कीड़े जो मतलब जो वो हाल होता है, ठीक है. It's a lot different. मतलब I know a lot of patients जो यहाँ पे भी होते हैं who are brushing a lot less than they should. They're not brushing at all, ये वो सारा. But at least दिन में एक दफ़ा भी अगर वो fluoride वाली toothpaste use कर रहे हैं, कुछ कर रहे हैं या mineral water पी रहे हैं, तो you can see कि इनके कम है caries या कीड़ा कम लगा हुआ rather than के जिनके बिल्कुल भी exposure नहीं है.
Okay, so that's what you've seen.
मैं उससे ज़्यादा मैं ये बता सकता हूँ कि for example I was in Australia, तो वहाँ पे there are like वो जो बिल्कुल वो नहीं होते holistic, no chemicals, ये वो वो fluoride के बगैर toothpaste use करना है, special पानी पी रहे हैं ये वो, and they did have a lot more like उनको जब भी मैंने वो देखा है मतलब उस तरह का patient देखा है, they have had significantly more carious teeth than a normal average person would have.
Right. Okay.
So, again, जो sample size मैंने देखा है, that's really small, but like एक वो था कि एक मेरे obviously एक bias था मेरे अंदर, but मैंने जो देखा है, it proved my bias.
So basically US में ना दो ये so there's one particular group of people who have sued the government, saying that there's too much fluoride in our water that is causing that may cause problem to our children, and then there's another group of people who have sued the government or trying to sue the government saying there's not enough. तो वहाँ पे ना बहुत variety है.
So वही है, it's parts per million. I've again forgotten the exact amount, but it's very less. ठीक है, मतलब and you don't need much more than that. ठीक है, so I think the stats speak for themselves कि जितना उनकी वो research है सारा कुछ है उसकी वजह से. So basically when इनकी फ्लोराइड वाला जो चक्कर हुआ था उसके बाद मूवमेंट वाले जो हुई थी उसके बाद I think it was the CDC या जो भी उनकी वो I think it was the CDC who claimed कि by the year 2000 there should be no more caries in children's teeth.
That's a prediction basically.
Which is obviously wrong. But again, there's a lot of reduction as well. But there are other factors which increased, अगर सिर्फ हम US के बारे में बात करें, which increased the incidence of कीड़ा लगना and all. For example, बीच में I think it was the 70s or the 80s जहाँ पे एक कोई रिसर्च हुई थी जिसमें ओबेसिटी के ऊपर था which said के फैट की वजह से ओबेसिटी होती है. ठीक है,
फैट इन फूड्स
ठीक है, जिसके you would know. उसके बाद फैट फ्री फूड आना स्टार्ट हो गया था. ठीक है, फैट फ्री फूड flooded the market, people started buying it सारा. उसके बाद they figured out that obesity is not going anywhere. It's still there. It actually increased. What happened was fat in your food provides a lot of the flavor in it. And so when you take out the fat, you take out the flavor. And how do you introduce flavor back in? You put in
sugar?
A lot more sugar. Yes. So, and as you would know, like jo proper research hai sara. So I think it was a Harvard research. Yeah, Stanford ki thi, Harvard ki thi, I think. And basically the sugar lobby had paid them off to give the results ke fat is the problem. But baad mein wahi pata laga, as you would know, like carbs and sugar is basically what causes you to gain weight. And as you increase the amount of sugar in the diet, the amount of caries, like fluoride can only do too much. ठीक है ना, जब like उनके I think हर चीज के अंदर, like you pick up bread, it has वो cornstarch and like sugar in it. You again sausages, you pick up meat, it has sugar in it. You pick up KFC, it has sugar in it. McDonald's has sugar in that. ठीक है, and it's gotten to the point like, and sugar is addictive. ठीक है, I think it's more addictive than cocaine या कुछ तरह. There is research on that.
That I don't know, but I know it's addictive.
There is research on it. I can't quote it, but like you can check afterwards. It's literally more addictive than cocaine.
Okay, yeah. I understand why the reason for that is like, Jesse, you have simple sugars, so it leads to a blood sugar rise and then a drop, and because of the drop, you have to have it again, right? So it's
so that's why you can say that fluoride didn't completely finish caries as well, because since the introduction of fluoride, at least in the US, their diet changed a lot as well. And throughout the world, like isi tarah, sugar content has increased in foods. Like literally just look at the cereals that you have in the morning. Like I have it as well at times, like in just the amount of sugar that you start your day off with.
Yeah.
It's too much.
Yeah. So in terms of tooth degradation, ek to hogi ke being more proactive and having the right habits, right? But even when you have that, how much does genetics play a part in, you know, कि कब तक आपके दांत गिरना या खराब होना शुरू हो?
Genetics does play a lot of part in your gum disease. ठीक है? So basically, gum disease does run in your family. You're probably going to have it. ठीक है? But again, you can, if you do take care of it, you can overcome it. ठीक है? Basically, आप इस तरह सोच लो कि I've seen like patients जो भाई होंगे, ठीक है, one of them does not brush. अब दोनों भाई हैं, genetics की बात करें, does not brush. मतलब वो ये bad habits, does not brush नहीं, but bad brushing habits. Teeth are relatively fine. दूसरी बहन होगी who's a bit more caring about her teeth. The teeth are a mess. ठीक है? So there is a genetic lottery that you can win, but again, उससे आपको सिर्फ ये होगा कि you can be a bit more careless if you've वो genetics आपकी उस तरफ अच्छी हैं, but some people are predisposed to it and चीज़ें ज़्यादा खराब होती हैं. But gums का मैंने ज़्यादा देखा है, gum disease का.
Gum disease, okay.
Mothers have it, उनके बच्चों को है, आगे it keeps going on.
Right.
And gum disease का I think diabetes runs in the family as well, तो उसकी वजह से भी gum disease आपकी होती है. So yes, that does play a big part. Genetics does, but again, that does not mean you don't take care of your teeth. The worst, again, if you feel you are predisposed to oral health problems, you should be taking more care of your teeth. But if you are not, that does not mean it will catch up to you one day if you're not taking care of your teeth, though.
Right.
You can't outrun that. The thing about oral health problems is that it's not always apparent. ठीक है? You जब आप मतलब कि डेंटिस्ट के पास जाते हो कि दर्द हो रही है, that's not you can have oral health problems without having pain. मैं अपने पेशेंट्स को काफ़ी बताता हूँ कि why you should have scaling or at least a checkup done every 6 months is that you will not know if you have if you have gum disease or not. And by the time you start feeling the effects of gum disease, like your gums start hurting, they start bleeding, at that point it's too late. Okay? And I would say gum disease is more damaging to you than even your teeth getting rotted. Because you can have perfect teeth, but your gums are what's holding them in place.
The base, yeah.
Your gums go away, all the teeth come out. I've had, I think in the past, a month ago, a patient that we had to take all of her teeth out. Literally all of her teeth out. Because the gums were gone.
Oh, okay. So if the teeth stay, then what happens? Like, will they start falling off themselves? So you take them off.
Basically, at that point, they're so loose. It literally, whenever they bite into something, it hurts.
Right.
You can't do any treatment on it because what treatment can you do? If it's not too bad, there are gum surgeries that you can do. Again, that's at that point, I would middle उस पे है तो then I would refer them to a periodontist, which is a gum specialist. But at a certain point, like you can tell that nothing can be done here. वो literally उसमें ये होता है कि you can literally hold the tooth like this and
oh shit.
हाँ, like उनका ये था. All we did was like numb our mouth. उसके बाद we didn't need to use our instruments.
Shit. Right. So gum disease is basically degeneration of gums, like in terms of volume, कम हो जाते हैं.
So there's bone underneath. So basically gingivitis होता है, which affects the pink part, जो आपके gums जो आपको नजर आ रही हैं, ठीक है? Then there's periodontitis, which starts affecting the periodontal tissue underneath, which is the bone and everything that's surrounding the tooth. And that starts to degenerate and the bone starts going down. So basically, if this is your tooth and you're holding it like this, the bone starts going down. Okay? And you would get to a point ke ye pura dant hai and itna sa andar pakda hai.
So the bone is going down, or is it like
it's
degenerating?
It's basically, and अगर आपकी थोड़ी सी मतलब कि bone loss हुआ है, it can sometimes come back. We can वो वापस regenerate कर सकता है, but I think if your half your tooth is exposed, ठीक है, there's nothing that can मतलब, then at that point you need gum surgery and sometimes you can be saved. Again, that would be a periodontal issue, तो वो हम periodontist को refer कर देते हैं, but अगर उससे भी नीचे चली गई भी है बात, your teeth's gone. And at that point you can't do anything. So yeah, that's why I tell a lot of people ke get regular checkups, because gum disease ka ye hai ke by the time you feel ke you have a problem, at that point it's usually too late. And the same is with dental caries, मतलब कीड़ा लगना सारा कुछ, it's not all, you will not always feel pain. ठीक है, मैंने काफ़ी दफ़ा पेशेंट्स को बताया है कि भाई आपका कीड़ा लगा हुआ है, डॉक्टर साहब मेरे दर्द तो नहीं हो रही लेकिन तो मैं नहीं करवाती, ठीक है, but you can still have an abscess, you can still have infections, ठीक है. So I gave some exams, उसके बीच में I had to study some cases and things like that. There are मतलब कि वो well known cases हैं कि एक औरत थी, I think it was in the US or UK, she had an abscess, एक infection on her thigh, ठीक है. She went to a physician, उन्होंने antibiotics दी, went away, ठीक है. Few months later came back again, क्या कहते हैं, infection, फिर से दी, went away. Third time she came back again. They did a biopsy, just study के जो पास आ रही है क्या, मतलब infection है क्या उसमें. Oral bacteria was there. They did x-rays, okay, OPG वगैरह किया. She had an infection in her tooth. They did a root canal. They finished the infection in the tooth. The problem in the leg went away. Simple as that. So
Right.
it's not isolated. The infection in your teeth are traveling in your body. So you can't ignore them. ये नहीं है कि मुंह में infection है. It's literally bacteria, pus and everything that's inside your mouth जो आपके दांत के नीचे पड़ी हुई है, and it is affecting your bone, it is affecting your blood. वहीं से आपके blood stream में जा रहा है. वही बैक्टीरिया जो आपके मुंह के वो दांत के नीचे है जो उसको इन्फेक्ट कर रहा है वो आपके हार्ट में जा रहा है, and 24 hours a day that heart is pumping that bacteria throughout your body. Basically think of it.
Right. How often have you seen this cases like this के travel हो रहा है?
Again, we don't do holistic उस तरह, ठीक है. So basically पाकिस्तान में इस तरह नहीं होगा. You will never have a physician जो टांग में दर्द हो रही है तो वो दांत को suspect करेगा, ठीक है. It hasn't happened to me, but I have seen cases, मतलब I've read cases about things like this. And एक और था, basically I think there was a nurse, she had high blood pressure, ठीक है. डॉक्टर के पास गई, सारा किया उन्होंने, हाई ब्लड प्रेशर की दवाई लेना स्टार्ट की, सब कुछ, ब्लड प्रेशर नॉर्मल. शी वेंट फॉर रूटीन चेकअप, शी नीडेड अ रूट कनाल डन, रूट कनाल ख़त्म की, हाई ब्लड प्रेशर वाज क्योर्ड because any infection in your body would cause a rise in blood pressure. ठीक है.
So it was like a sudden rise in blood pressure.
Yes.
Okay.
So basically, again, these are example cases. ठीक है. I'm probably not doing justice to it. ठीक है. But this is a proper case, Joe. It's well documented, and it was that after that she stopped taking her blood pressure medication.
Right. So I guess the crux of what you're saying is that if you cannot pinpoint where the infection is coming from, it's a good idea to check the oral.
It's basically, I think कहीं भी आपके मसला ये तो पहली चीज़ आपके दिमाग आपके वो मुंह से ही start होगी. It's like literally the entry point of your system, ठीक है.
Right.
So whatever is wrong here, it is going to spread throughout. And and it's not an isolated thing. So I think your overall physiological fitness, your mouth needs to be in good health, and you would probably be eliminating a lot of your a lot of problems.
And I'm thinking that the first thing that might be affected would be your gut health, right? Because of a bad oral hygiene or bad things here like around in your mouth.
Yes and no. I think सबसे ज़्यादा जो affect करेगा, it is again the heart.
Achha, it's still, you think it's blood, basically, the related blood.
So like again, the most well documented and like जो इस चीज़ पे हमारा भी मतलब कि वो पढ़ाया भी वो जाता कि the heart is affected a lot, ठीक है. But yes, so I think जो जहाँ पे gut की बात चली गई है वहाँ पे यही है कि that's basically the diet that you're having as well.
Right.
But again, if you have something that's literally rotting in your mouth, ठीक है, if you put a steak out, ठीक है, आपने 4 दिन उसको नहीं हाथ लगाया, it's going to start smelling, you won't eat it, right? That's the same thing that would happen to a piece of meat that's stuck in your tooth, ठीक है. वो 4 दिन बाद it's practically the same thing. It's as if you're eating that, putting that in your mouth, और वो 4 दिन बाद आपके gut के अंदर चला गया, it's going to cause problems. So yes.
So in terms of visiting the dentist, every 6 months, twice a year? That's the best thing? Okay.
Yes. Again, depends on your oral health, ठीक है. In people who have bad oral health, I would say 3 months, ठीक है, just to make sure that you are not developing new problems as we go along, ठीक है. कि for example, अगर आप मेरे पास आते हो और आपके 12 दांतों में cavities हैं, ठीक है, I cannot realistically be like कि हाँ मैंने एक दफ़ा आपको बोला है दिन में 2 दफ़ा ब्रश करो और फ्लॉस करना स्टार्ट करो, तो you're going to start doing it.
You need to check them again. Yes. Yeah.
So basically you need follow-ups, but again patient motivation is paramount in that. पाकिस्तान में वही है कि it's बहुत महंगा है डेंटिस्ट के पास आना, ये करना वो करना, तो you would rather not do it. You would rather it's funny. where we used to, so where I work, उसके साथ पहले salon होता था, ठीक है? So obviously there would be a lot of मतलब वो clientele share होती थी. People would be willing to pay 50K for like a hair, like मतलब every month, like जाके वो जो भी करते हैं, I don't know what it was, जो भी treatment था, I don't want to name it कि मैं गलत ना बोल दूँ, but she was a patient, she told, मतलब इसी तरह बातें करते हुए कि हाँ ये 50,000 लेते हैं डॉक्टर साहब, मैं तो हर महीने आके करवाना पड़ता है ये वो. And the same patient, ठीक है, when we told them कि आपने scaling करवानी है, she asked us for a discount, which is basically 1/5 of what she paid. Yeah. And she had a problem paying for her scaling. And then when we said, oh, you need 7 fillings done, that's too expensive. And it was still cheaper than almost as much जो हर महीने वैसी करा रही हैं. So again, people are not willing to invest in their teeth, so you can't do much. But when things go wrong, वो तभी आके हमें blame कर रहे होते हैं कि आप बहुत expensive हैं. When we were telling you कि ये करवा लें, अभी early stages पे you didn't get it done, but again, we're responsible again के बाद.
Yeah, it's the same thing with physical health, right? Like I think it's like they're not willing to invest in health at all.
Yeah, exactly.
है ना?
जब तक वो आपको तंग नहीं कर रहा.
हाँ, proactive तो कुछ नहीं करना.
मैं आपको ये बता सकता हूँ. So I have a lot of patients. So antibiotics and dentistry is a very touchy topic in Pakistan. So internationally, you're not supposed to give them. ठीक है?
Dentists aren't supposed to give antibiotics.
मतलब you can, but like when you have a dental issue, when you have an abscess, when you have मतलब basically दांत में root canal होना होता है, ठीक है? When you give antibiotics, the pain goes away. ठीक है? In very simplistic terms, when you have an infection, pressure बनता है, वो वहाँ पे basically liquid बनता है, pus बनती है, that starts putting pressure on your tooth, on the surrounding tissues, that causes pain. ठीक है? When you give antibiotics, the pressure goes down. वो जो bacteria है वो काफ़ी हद तक थोड़ा सा मरना start हो जाता है, the pain goes away. But the root cause of the infection is still there. ठीक है? It's like a house for bacteria. You can empty it out no matter how many times you want. It will still come back क्योंकि
घर तो है,
घर तो उधर ही है. ठीक है? वो कभी ना कभी फिर से बैक्टीरिया आएगा, उधर बैठेगा. अब पाकिस्तान में यही होता है कि वो आपके पास 3 दफ़ा आएंगे, वो आपको बोलेंगे कि डॉक्टर साहब आपको रूट कनाल की ज़रूरत है. नहीं, बस एंटीबायोटिक्स देते हैं, हम खुश हैं इसमें. ठीक है, आपने नहीं करवाना, यू कांट डू एनीथिंग, बट दे वोंट के लाइक लिटरली वो हर 3 महीने बाद आके एंटीबायोटिक्स आपसे मांगेंगे. दे वुड रिस्क लाइक बैक्टीरिया रेजिस्टेंस अपने अंदर, एंटीबायोटिक रेजिस्टेंस वो रिस्क कर लेंगे, लेकिन
Do you think it's a money thing, or is it a thing about being afraid of an invasive procedure in their mouths?
I think it's feeling you're smarter than the other person. That's where smarter than the dentist. The guy is trying to rip me off. इसको नहीं पता, ये तो पैसा कमाने के लिए बैठा हुआ है, तो मैंने नहीं करवाना. Basically, I feel that it's that. So, for some, it is a money thing. ठीक है? I do feel, and I think a lot of dentists do this as well, if it's purely a money thing, you can usually tell, and you do cater for that. Okay, you can a lot of people do charity patients, a lot of people do discounts, but again, if you're rolling in a V8, ठीक है ना, BMW बाहर खड़ी हुई है, and you're asking me कि यार ये बहुत महंगा है, हमने
ये 7 पार्लर से आ रहे हैं आप after getting your hair done. That's not a genuine case. Yeah, bro, no. नहीं, but I can understand if it's someone who has like a phobia कि यार नहीं वो drill करेंगे तो ये करेंगे वो करेंगे.
So that is again, I had a phobia for dentistry. वो तो वही है कि I had braces as well, and my own dentist used to be really good. So I think dentists play a big part in that aspect as well. I won't want to say it for everyone, but like मेरा अपना जो experience था, like as a child, hospitals के dentist, फौजी, मतलब डेंटिस्ट के पास गए थे, उन्होंने 100 पेशेंट दिन के देखे में ऑलरेडी दिमाग उनका फ्राइड है, तो देर यूजुअली नॉट वेरी नाइस विद यू.
पर वैसे ही स्ट्रिक्ट होते हैं ना,
वही ना,
बेटा ब्रश नहीं करते आप.
हाँ, नहीं आप रोना शुरू हो, चुप करो, ये करो वो करो, आपको डांट रहे हैं ऑलरेडी, आपकी क्या you're scared है, फिर वो डेंटिस्ट आपको डांटना भी शुरू कर दे, you're not going to.
Yeah.
So I remember like I've had very bad experiences with dentists and phobia tha, but like
Sorry.
I felt ke the dentist that I ultimately went to, he fixed the phobia, and like we you have to be nice with the patient, you have to understand that they're scared, you have to go slow, you can't be like हाँ मेरी आधे घंटे की appointment है मैं ख़त्म कर रहा हूँ ये वो सारा नहीं. You have to take your time with each patient's different. For example, अगर मेरे पास if a child comes in, you usually don't do any treatment in the first visit. ठीक है?
A child meaning how old?
Up till even, I would say, again depending on the child, but up till even 10, like if they're scared, you can visually see that they're scared. Okay, don't do anything, just as long as they're not in a lot of pain, where obviously that would be a different situation. But agar wo cavity hai, you just first time they come, you have a nice chat with them, you make them feel comfortable, unko dikhao ki haan yahan pe aane se kuch bhi nahi hota sab kuch, and then next time they come, they trust you as well. You tell them it's not going to hurt, it's not going to do this. So they're usually more cooperative. But again, usually children are Russian roulette. Like you can, sometimes you can do whatever you want. They're not going to cooperate with you. General anesthesia mein karna padta hai.
Sahi. Interesting. Yeah. My experience with dentists was good because I don't know why when I was a kid, I was like very enthusiastic about getting braces. तो जब अब मेरे लाइक वो दांत निकालने पड़े थे बिफोर गेटिंग द ब्रेसेस, तो आई वाजंट लाइक ओह नो आज मेरे दांत निकले, आई वाज लाइक ओह यस.
आई हैव सीन दैट एज वेल. Kids like braces for some reason. Yeah. And वो ये कि वैसे दांत निकाल रहे हो नहीं, लेकिन braces के लिए दांत निकलने, they'll be scared but they'll
go through it.
They'll soldier through it.
Yeah.
कोई नहीं हो जाएगा, मेरी मर्जी है.
Yeah.
I think वो भी है कि it does seem cool to them.
It seemed cool to me. Yeah.
It does. You see a lot of your friends having it. You're like, मुझे भी चाहिए सारा कुछ. And I feel के braces, I think they change your life a lot as well. I think your self-image, your self-confidence goes through a massive spike after you get your braces done. So दांत सीधे हैं, you're more confident, everything. So that's good.
For me, it wasn't like a very bad scenario that I had कि बहुत इनको ठीक करना है, थोड़े से ज़्यादा आगे थे, थोड़ा सा उनको push back करना था. So it wasn't like life changing for me in that sense, but it was just like, oh fun यार, this is good scene.
For me it was pretty bad.
अच्छा.
For me it was pretty bad, like I could not literally smile.
Oh, okay.
And basically changed my whole dentition type. And made a huge difference. So that's why like whenever a kid comes in, एक तो माँ बाप का होता है ना कि they want, like I always ask जब when they're on the fence, ठीक है, I always ask the child कि do you want them and why do you want them, ठीक है, because it's very different from person to person, ठीक है. Sometimes आपके smile में there will be a minor thing, ठीक है, which for you मतलब कि किसी को देखी would not even probably notice that, ठीक है, कि दांत के बीच में छोटा सा गैप है, but the child, उनको दिमाग में internally वो होगा कि अच्छा मैं स्माइल नहीं कर रहा क्योंकि वो नज़र आएगा, लोग मजाक उड़ाएंगे, whatever it is. But I think it's a lot for yourself as well and for the self-confidence of the child as well कि you should get them done.
Right.
Yeah.
Great. Well, Omair, it was great having you.
Yeah, great to be here.
Yeah, good conversation. And for everyone who's still watching till the end, thank you so much for watching. I'll see you all in the next episode of the NSJD show. This is NSJD signing out. Allah Hafiz.